Today I'll be talking to Dr. Radhika Kamat about recurrent bacterial vaginosis or BV. Are you someone who is suffering from this? Do you have pain and soreness in your vaginal area and fishy discharge? All these symptoms but no itchiness? Have you already tried working with the gut and your diet but found little progress? Dr. Kamat begins by talking about what BV is and why it gets so recurrent.
BV is a very resistant case. It's a polymicrobe because it has other microbes, not just, one thing. There's many microbes in there. Not just the regular Gardnerella is usually checked, but there will be Prevotella. These are all anaerobic microbes, and they have low lactobacilli. They become very resistant for some reason. We don't know why. In my opinion, it is to do again with the immune system, the lifestyles, because this is what I've of course seen in most of these resistant cases. They have a very high cortisol lifestyle. And smoking is also has shown to cause these microbes to come in. Multiple partners, again, hormonal conditions like low estrogens, not high.
Okay, all that information is kind of useful, but I asked her for a case study so that you can follow along and see if this case study is you.
She was only on the antibiotics when it flared, and she didn't know what to do about it. But it took almost more than a year for her to clear it up and stay without having any flares for good 6-7 months. And occasionally, if she had any flare, then we would start again all those treatments, check back on the lifestyle.
Okay, the important question. What if the BV is not clearing up?
If the BV is not clearing up, in this case, a woman who had it, she's having very high cortisol, working crazy hours. So it was very difficult for her to clear up. And as a result, we had to do like continuous monthly checking in as to see what the situation is, checking pH every 2 weeks. So it got to a place where it was much better. The BV didn't show up anymore. It was all negative in the cultures. Continue with the herbal treatments for at least the next 6 months because it was so resistant, and she had it for the last 10 years or something.
As you already realized watching this video, it is not so easy taking care of a recurrent BV case. 2 points here. The first is about checking in with pH strips. Dr. Radhika talks a lot about using pH strips to determine where in your cycle you're having the flare and what it might be. So check out this video here. Also check out the video on using probiotics too much, which makes you end up with this condition here.